Welcome to Sunday's Health Update with Dr. Tabah from North Shore Gastroenterology.
Good morning. We're glad to have Dr. Kimberly Harris with us this morning. Dr. Harris, we have a lot of patients who complain of heartburn, and actually heartburn is a common symptom. When is it concerning for patients and when they should consult their gastroenterologist or physician?
About 50 to 60% of the population will experience heartburn symptoms at some point. It is important to see your physician or your gastroenterologist if you're noticing an increase in your symptoms, more severe symptoms, or any development of new symptoms such as problems swallowing, nausea, vomiting, or weight loss.
These patients who come here for evaluation of heartburn, some of them we diagnose with a condition called Barrett's esophagus. Can you tell us a little bit more what is Barrett's esophagus?
The majority of people who come here with heartburn symptoms will have a normal endoscopy. A smaller percentage will have inflammation at the end of the esophagus called esophagitis. And about 1 in 10 patients will have chronic changes at the end of the esophagus called Barrett's esophagus. It's important that we identify those patients because they require advanced screening.
So do these patients have higher risk of esophageal cancer?
That's correct, and those changes can have an increased risk of cancer, up to 40-fold increased risk. So it's important that those patients receive additional screening.
In addition to screening these patients, do we have options to treating them?
There are many options for treatment for people who have Barrett's esophagus. It is important that you have the screening test so we can identify changes in the esophagus and offer those treatments to select patients. There is a higher percentage of males who have this condition as opposed to females. Additionally, the Caucasian males have a significant increased risk.
What other risks do the patients have to avoid to decrease their chances of developing esophageal cancer?
The other important factors that can be associated with Barrett's esophagus and esophageal cancer is smoking and alcohol intake. So it's important to monitor those things.
Thank you again for this very helpful information, Dr. Harris, and thank you for being with us this morning.